Hey guys, my name is Anuradha. Welcome to our channel GK Guidance and Knowledge. Happy morning to all of you. Today we are going to discuss about takeaways from HIV AIDS to fight with COVID-19. Let's begin with the question. Our today's question is: we can draw key lessons from chronic epidemics such as HIV AIDS to stem COVID-19 pandemic. We have to comment on it. It means we need to provide details about the HIV AIDS program and what are the lessons we take from it, and our comment in major section, and finally with the conclusion. Significance of this question that can be asked in GS paper 2 under the headings of government policies and interventions, and can be asked in GS paper 3 under the heading of health, science, innovations and discoveries. Our introduction would be: it is not for the first time that when the world has experienced such a major epidemic as COVID-19, because before COVID-19 we face HIV virus, HIV AIDS, swine flu, smallpox. India was which is most affected after USA by COVID-19, as infections resulted lakhs of deaths, and previously we successfully eradicated epidemic like polio, smallpox. So we must learn from the past experiences of the other epidemics and implement them to stem COVID-19. Lessons. Let's discuss about the connection between HIV virus or epidemics with the current COVID-19. Connection between both COVID-19 and HIV virus. HIV and AIDS both are contagious and life-threatening disease. Then 70% death due to COVID-19 of people who are suffering from HIV, AIDS and other severe diseases like hepatitis, diabetes and even more others. Then fear and stigma in the society for both sides, for both the diseases. Then both killing most vulnerable section of the society, means poor people, elder citizens, children's. Then lack of response from the government. Then what are the lessons we take from the past epidemics? First of all, awareness, which is the most important thing. We all know about it and we need to spread it. Continuous and rapid increase in awareness, we need to spread it and promote people to follow social distancing, means mask, sanitizer, social distancing, COVID-19, COVID appropriate behavior. We can spread awareness through campaigns like on TV, on radio, through movies, short films, documentary, and most famous social media platforms. Internal cooperation we need. State and central government, it should work together and share information, resources, knowledge, experience, technology, technical expertise to curb COVID-19 spread. Then global cooperation needed. Various countries, means developed countries and developing countries, and various organizations like World Health Organization, Gavi, the Vaccine Alliance, United Nations need to collaborate, because COVID-19 is not only one country, one issue, one country, one person or one government issue. Then funding. Government need to specifically focus on the funding, because lack of money means lack of vaccine, shortage of vaccine, medicine and other medical facilities. So we need to provide funding to resolve all these issues. Then remove stigma and vaccine hesitancy, which is the most important, because if we have vaccine and people doesn't ready to vaccinate themselves, then it was more worse than we don't have vaccine. There are so many misconceptions in our society about COVID-19 and its vaccine. So we need to provide proper information to remove them, and leaders can also play a role, that if they come first to vaccinate themselves, then others will also follow them. Then ensure proper supply chain. Vaccine need special cold storage facility from manufacturing unit to delivery. For delivery of vaccine, for vaccination, we need to improve it to stop wastage of vaccine, which help us to reduce vaccine shortage. Then remove barrier of actions like misinformation, myths, fake news and lack of sanitation, hygiene, healthcare cost and then fear of unemployment. Need to remove these actions, need to remove these barriers. Then special focus on vulnerable population, means the senior citizens, older citizens, elder citizens, people with chronic disease, which I also told you, then people with diabetes, people with hepatitis and others, cancer, they are more affected. Then children and pregnant women are vulnerable section, need to vaccinate them proper care. Then use technology. Technology can also play a vital role to curb COVID-19. We can use drones to provide vaccine for far-fetched areas. We can use robot to provide vaccine, medicine, food, and other essential services, and we can also diagnose them through robots to curb the spread of COVID-19. Then what are the challenges? Vaccine hesitancy and unhygienic behavior. Then lack of funding and cooperation between center and state, which is most prominent in today's work. Lockdown without people concerned then lead to anxiety, depression, isolation. Then poor control on fake news. Even leaders also spread pseudoscience which doesn't have any principle or facts. Then poor health infrastructure and low spending. Then what is the way forward? Need to make national policy and proper implementation of continuous increase of it, and continuous increase awareness and removing stigmas related to COVID-19 and others. Then need to increase funding and proper collaboration with the state. Then develop health infrastructure and increase spending. Then intensive follow-up action required. Then must collaborate with economists, scientists, doctors, researchers, civil societies, and other policymakers to make strategies and implement them properly. Then our conclusion would be, with above mentioned steps, government need to work on collective actions. Government as well as people need to take steps in right direction and follow COVID appropriate behavior. It will help us to save so many lives and help us to achieve sustainable development goal 3, which is good health and well-being. So this is it for today. Thank you for listening. Don't forget to like, share and subscribe. Also provide your suggestions to improve. Jai Hind, Jai Bharat.